Hi guys, so now I will be discussing about all the important topics from all subjects. Okay, so I made these videos keeping in mind about your NEET PG 2022 exam, which is somewhere around your second week of March. Okay, so I made these videos for candidates of NEET PG 2022. Okay, but the other candidates who are targeting your FMG or INI set, right, or your next exams, for them these videos are also relevant because the subject and topics remain same. This is because these all are national board exams, so the topics and subject remain same for all of the candidates, and you must go through these topics once before preparing the exam. This is a very important topic list, and the source is your 5-year question papers, right? Last 5-year question papers. You can also flip through them, and so then you can understand the importance of all the important topics that I listed in one video. Okay, all right. And talking about this one, those candidates who are targeting for next 2023, they have more than 1 year for the preparation. They should go through all the topics that I mentioned. These topics is not, remember, this topics is not the, or not all. Okay, means this is not a complete means complete a set of topics that you should study, and this is not that you should not study other topics. Okay, this is just for your last minute revision purpose of the topics you should not miss before appearing the exam. But remember, the more you study, the more chances are there for you to crack the exam, because this is a competitive era. There is no shortcut, so this is not a shortcut anyway. This is just a set of important topic list that you should not miss. That's all. Not that you should appear the exam by studying these topics only. Don't do this mistake. You have to study each and every topic, but this is the set of topics that you should not miss. I am again repeating, don't take these topics as granted, or don't take these topics as the only topics that you have to read. This is not like that. These topics are the set of important topics that you should not miss before appearing the exam. Okay, and those candidates who have who have started almost 6 months back, so they are already on the process. So I suggest you to go through the topics once, and still there is time at your hands. So whatever topics you have not touched till now, you should go through them at least once. Okay, and those who have started very recently, within 2 months or like that, for them I will mark some topics as the 5-star topics. So I will mark some topics as the 5-star topics, right? And I will advise them to start their preparation with the 5-star topics first, and then if you have some time in your hand, you should go through the other topics as well. All right, if you have got some time. And also guys, do give GTs regularly. That will boost your marks. All right. Okay, so without any delay, we will start with our first topics. That is, one second. Yeah, so we'll start with anatomy, right? So we'll see the important list of topics. I have tried to make it crisp and short, but actually I have to make justice with the subject as well, right? So for those who have less time in your hand, I will mark the important topics as 5-star topics. So for you, those who have very less time in your hands, you should start with the 5-star topics first, and then if you have got some time, then you can go back to the other topics. And for those who have got who are in the preparation, don't miss any topics from this list. All right, so first topic is your this one, cranial nerves and nuclei. Very important. Clinical scenarios may be asked from this topic, cranial nerves and nuclei. Like they will give a clinical scenario, and they will ask which part of the brain is affected, right? So just revise these cranial nerves and nuclei. And just if I give an example, so they give something about ptosis, and like the patient has ptosis and this that, so which cranial nerve is affected? So you can say that by third cranial nerve. Alternatively, they can give a set of images right, set of images, and there you can see a person with a ptosis or the drooping of one eyelid, and they can ask like which nerve is paralyzed here, so then you can answer like it is third nerve palsy, like that. All right, and also with the location, like you know that in midbrain second and third nerve is located, right, in pons 4 5 6 7, like that. So and in medulla 19 11 12. So these things do keep in mind while preparing from this topic. So you have to correlate the cranial nerves with the applied anatomy. All right, then back muscles and their nerve supply. So both of these topics are 5-star topics. All right, this is also 5-star topics. Okay, cranial nerves, back muscles, 5-star topics. Then composite muscles and hybrid muscles also important. Brachial plexus, branches and pelvis is also important. Root vellus and dermatomes, upper limb, lower limb. This is also important, particularly root vellus of reflexes, like your knee reflex, which is your L3, L4. So these questions has been asked previously as well. So this is also comes under your 5-star topics, right? Then arteries and branches, subclavian artery, axillary artery, particularly internal iliac artery. The divisions, anterior and posterior divisions, both are important. This also comes under your 5-star topics. All right. Then your nerve supply of perineum, ear, eye. Okay, relations of your lesser sac, parotid gland, stomach, liver, blood supply important. Stomach blood supply is very important. Is a 5-star topics. Peritoneal anatomy is also important. Okay. Then let's move to embryology. So from embryology, your notochord is important, 5-star topic. Tongue development, test buds, nerve supply. Yes, test buds and nerve supply is also important, 5-star topic. Male and female genetic tract development, also important, 5-star topic. Your pancreas and kidney development, umbilical cord. Yes, this is also a 5-star topic, umbilical cord. Ventral wall defect, your one second, I will write it for you. Gastrocrisis and your omphalocele. Okay, these two are also important topics, though they come under surgery. Okay, then fetal circulation. Yes, this is also a 5-star topic. Okay, derivatives of different germ layers, neural crest derivatives, also a 5-star topic. Branchial arc, cleft derivatives. Okay, this is also a 5-star topic. All these are important, guys. Okay, spermatogenesis, oogenesis, mitosis, meiosis. This is also a 5-star topic. From osteology, types of joints with examples has been asked, 5-star topic. Your ossification centers, knee joint, ligaments. You have to learn this with orthopedics and injuries. Okay, now we will go to your neuroanat. All right, one second. Okay, so yes, from your neuroanat topic, your cavernous sinus, boundaries and structures passing through it, particularly from the central part of the cavernous sinus, the 6th nerve passes. So these are your important topics, 5-star topics, right? Blood supply of your brain. Then actually there is the circle of Willis. Okay, this is also important, 5-star topic. Then your brainstem sections, very important, 5-star topic, right? Diagram will be given. You will be told to identify different areas. Okay, you say internal capsule or putamen, right? Then your ventricle boundaries, very important. Your glial cells in CNS, Bodman's area and applied, very important, 5-star topic. Okay, like your this one, Broca's area, I have discussed it in my video, both Bodman's area, this cavernous sinus, Wernicke's area, right, with the area number and location. Also the Broca's area number, location, function. Okay, so all this very important, 5-star topic. Thalamic connections, important. Perineum, yes, perineum, particularly injuries, right? This urethral trauma, very important, 5-star topics. I think I should take a different pen. 5-star topics. All right, then rectum and canal anatomy, Spermatic cord contents, report system derivatives with embryology, very important. It is a 5-star topics. Okay. Talking about histology, first topic, listoepithelium or lining epithelium of various regions, very important 5-star topics. Then heart arterial anatomy, yes, heart development also from truncus arteriosus, that part means heart arterial anatomy plus development, very important. Diaphragm with embryology and openings of diaphragm, very important, and I have already covered in my video list, very important 5-star topics. Bronchovascular segments of lung, important. Lung hilum is also important. Types of cartilage, hyaline, this one elastic, right? And the identification of the histopathology slides, very important 5-star topics. All right. Collagen distribution, important. Retinal layers, very important. 10 layers of retina to identify as well. All right. So from head and neck, Terrian is very important topic, 5-star topics. Then skull foramen has been asked. Then Freiss syndrome, also 5-star topics. Okay. Laryngeal muscles and nerves, lymphatic drainage of the face, scalp layers and applied, all these are important topics. Head and neck is always an important topic. Muscles of mastication, very important. Danger space of the neck, 5-star topics. Okay. So all these are 5-star topics and you should not miss anything from here. If possible, you should learn more from head and neck, but these are the set of topics which you should never miss. Okay. Okay, so next we will go with the abdomen, epiploic foramen boundaries and contents, very important 5-star topics. Lower limb femoral attachment, this attachment of the gluteal muscles and their nerve supply, their actions, very important. Trendelenburg sign, these are very important 5-star topics, both of them. All right, you have to know which side is normal, which side is defective, which muscles are involved. Remember the side which is the side which goes, say this is a Trendelenburg sign, the side which is affected is actually this is the side where Trendelenburg sign is positive, actually it is the normal side. Okay, the other side is defective because the other side gluteus muscles cannot uplift the paralyzed side, that I will discuss in another video. Okay, but these are some important topics which you should pay your attention. Okay, in particularly in anatomy. All right, you should not miss these topics. All right. Okay, so this is all about your anatomy.